Executive Office of Health and Human Services is releasing new data on which long-term care facilities are not in compliance when it comes to COVID-19 infection. State data reveals more than half of Massachusetts' COVID-19 death toll comes from these facilities, and one Longmeadow facility, the Levitt Family Jewish Nursing Home, has had 66 deaths attributed to COVID-19. Western Mass News digging deeper into the state's inspection process and the number of local facilities that were deemed not to pass their baseline audits. Western Mass News reporter Audrey Russo has the details.
She's calling us all the time asking for stuff, and it's hard to we gotta mail it to her, and we can't see her.
Laurel Charlin's mother lives in Heritage Hall West, one of the Western Mass facilities hit hard by the COVID-19 pandemic. She says her mother has recovered from the illness, but with no visitors allowed inside, Charlin says it's difficult to tell how well the facility is following infection control guidelines.
It's just hard not knowing what's going on, really.
State health officials have begun sharing the results of infection control audits being conducted at long-term care facilities around the state. The nursing homes were graded on a 28-point scale using a list of criteria. Some of those criteria, called core competencies, were so important that even if a nursing home scored a 27 out of 28, if they missed one core competency, they would be considered not in adherence. The core competencies include criteria like separating COVID-positive patients from COVID-negative residents, closing down communal areas, and use of personal protective equipment. In Western Mass, more than 7 facilities failed to meet a core competency. But as the CEO of one of those facilities pointed out, the audit's PPE guidelines were strict in a time when access to supplies was tight.
We have a 42-bed, nursing home. It's our only nursing home, and we don't have a hospital behind us who's a machine out there being able to access equipment and PPE for the hospital and then sharing it with the nursing home.
Margaret Mantoni tells Western Mass News when the auditor came through Loomis Lakeside at Reed's Landing, the facility was following the CDC guidelines for conserving eye protection. But she says when staff was observed not wearing eye protection at all times on the non-COVID unit, they were dinged.
For what we believe to be in compliance, but what the auditor did not believe to be in compliance.
Loomis Lakeside has since been re-audited, and they are in compliance. Through statements sent in response to Western Mass News inquiries, we've also learned that Care One Holyoke, AGAWAM Healthcare, Heritage Hall South and West have also been audited again and are in compliance. Heritage Hall East is currently undergoing re-education in infection control. But Mantoni says funding is on the line for facilities that didn't meet a core competency in the first baseline exam.
The amount of reimbursement that the additional funding that you receive is reduced.
And she says when PPE is considered a critical part of infection control, it's difficult for some facilities to keep up in a shortage.
In some ways, yes, the smaller nursing homes are probably at a disadvantage and then don't get all the funding.
In Springfield, Audrey Russo, Western Mass News.